Did the U.S. Centers for Disease Control and Prevention fraudulently add deaths from poisoning, trauma and unintentional injury to its tally of COVID-19 deaths? No, that's not true. That claim is based on a mischaracterization of CDC listings of patients' other health conditions, which are commonly listed on death certificates as comorbidities. The claim cites as a source C19 study, an anonymous web post that poses as a scientific study while adhering to none of the transparency, peer review, and critical thinking conventions by which scientific thought is advanced. The C19 study webpage makes false claims about the findings of published medical research. The claim about inflated COVID-19 death tolls appeared in an article published by Gateway Pundit on September 3, 2020, titled "This is Fraud," which opened, quote, 10% of reported COVID-19 deaths for those under 35 as reported by the CDC are due to poisoning, trauma and unintentional injuries. End quote. Users on social media saw this title, description and thumbnail, quote, "This is fraud, 10% of reported COVID-19 deaths for those under 35 as reported by the CDC are due to poisoning, trauma and unintentional injuries. The death rates for COVID are questionable at best. And you won't believe the category for 10% of the COVID-19 deaths for individuals under the age of 35. On Saturday night we posted an article about COVID-19 shock report. This week's CDC quietly updated COVID-19 numbers. Only 9,210 Americans died from COVID-19 alone. End quote. That's not what the CDC data shows, said Jeff Lancashire, a spokesperson for the CDC, in a September 4, 2020, email response to questions from Lead Stories, quote, "In looking at the tables, it appears to be more like 3%, 135 plus 40, 5,424, and not 10%. However, this still doesn't mean the deaths were due to poisoning, trauma, and unintentional injuries. It just means that those were also listed on the death certificate. We don't currently know how often COVID-19 is the underlying cause in cases where the decedent contracted COVID-19 while being treated in the hospital for injuries, which could explain some of these cases." End quote. Dr. Robert Anderson, chief of the Mortality Statistics Branch of National Center for Health Statistics, said terminology is being misused in claims like this. In an August 31, 2020, email exchange with Lead Stories, Anderson said this family of claims about fraudulent data blurs the important distinction between cause of death and comorbidities, which are other medical conditions listed on the death certificates of persons killed by COVID-19. Anderson wrote, quote, death certificates list any causes or conditions that contributed to the death. These causes are entered into the death certificate by a physician, medical examiner, or coroner. Death certificates may have one or more causes or conditions listed, as determined based on the medical expertise of that professional. The underlying cause of death is the condition that began the chain of events that ultimately led to the person's death. In 92% of all deaths that mention COVID-19, COVID-19 is listed as the underlying cause of death. As of August 22, there were 161,392 death certificates that listed COVID-19 as a cause of death. In 6% of the death certificates that list COVID-19, only one cause or condition is listed. In 94% of deaths with COVID-19, other conditions are listed in addition to COVID-19. These causes may include chronic conditions like diabetes or hypertension. They may also include acute conditions that occurred as a result of COVID-19, such as pneumonia or respiratory failure. End quote. The Gateway Pundit article is one in a series that claim thousands of COVID-19 deaths could have been prevented by hydroxychloroquine, an anti-malarial drug in use for at least 60 years. Lead Stories has previously debunked a related claim that a massive international study showed a much lower COVID-19 mortality rate in countries where hydroxychloroquine was prescribed to patients. The U.S. Food and Drug Administration granted emergency use authorization early in the pandemic when doctors tested hydroxychloroquine's anti-inflammatory effects, but the FDA then revoked that authorization after studies indicated the risk of using it outweighed the benefits. After President Donald Trump ignored U.S. public health experts and declared that he thinks it works, pro-Trump sites like Gateway Pundit took up the cause. But Gateway Pundit relies heavily on C19 study, an anonymous web post that misstates the findings of at least 2 medical journal papers it cites as proof of its claims. Though it poses as a massive international study, it does not qualify as a scientific paper. There is no named author. The map included does not list the data source for its illustration.